Thank you so much, Minister Allen. Good morning, everyone, and happy Sunday. Today, my topic is going to be on suicide. As this month is Suicide Awareness Month, I'm going to touch on that a little bit today. Just remember that there's always help available for you. And most importantly, if you're listening to the service, the Lord is here and he's able to get you through any circumstance or any situation. So let's begin. So what is suicide and are there warning signs? Suicide is death caused by injuring oneself with the intent to die. A suicide attempt is when someone harms themselves with any intent to end their life, but they do not die as a result of their actions. Warning signs aren't always obvious, and they may vary from person to person. Some people make their intentions clear, while others keep their suicidal thoughts and feelings a secret. So what are some of the causes? Suicidal thoughts have many causes. Most often, suicidal thoughts are the results of one feeling like they can't cope when they're faced with what seems to be an overwhelming life situation. If you don't have hope for the future, one may mistakenly think suicide is a solution, but no, this is not the solution. One may experience a sort of tunnel vision, where in the middle of a crisis, they believe suicide is the only way out. There also may be a genetic link to suicide. People who complete suicide or who have suicidal thoughts or behavior are more likely to have a family history of suicide. So what are the risk factors? Although attempted suicide is more frequent for women, men are more likely than women to complete suicide because they typically use more lethal methods such as a firearm. One may be at risk of suicide if they attempted suicide before, feel hopeless, worthless, agitated, socially isolated, or lonely, experience a stressful life event such as a loss of a loved one, military service, a breakup, a financial or legal problems, have a substance abuse problem, alcohol or drug abuse can worsen thoughts of suicide and make you feel reckless or impulsive enough to act on your thoughts. Some may have suicidal thoughts and have access to firearms in their home, having an underlying psychiatric disorder, such as major depression, post-traumatic stress disorder, or bipolar disorder, have a family history of mental disorders, substance abuse, suicide, or violence, including physical or sexual abuse, have a medical condition that can be linked to depression and suicidal thinking, such as chronic diseases, chronic pain, or terminal illness. Someone may be a lesbian, gay, bisexual, or transgender with an unsupportive family or in a hostile environment. Possible symptoms: talking about suicide, getting the means to take your own life, such as buying a gun or stocking pills, withdrawing from social contact and wanting to be left alone, having mood swings, being preoccupied with death, dying, or violence, feeling trapped or hopeless about situation, increasing use of alcohol or drugs, changing normal routine, including eating or sleeping patterns, saying goodbye to people as if they won't be seen again, developing personality changes, or being severely anxious or agitated, particularly when experiencing some of the warning signs listed above. Children and teenagers, actually, unfortunately, lately a lot of them have been committing suicide. So let's talk about some of the symptoms that we may see in children. Suicide in children and teenagers can follow stressful life events. What a young person sees or as serious or insurmountable may seem minor to any adult, such as problems in school or loss of a friendship. In some cases, a child or teen may feel suicidal due to certain life circumstances. If he or she may not want to talk about it, such as having a psychiatric disorder, including depression. Loss of conflict with close friends or family members can contribute to the children or teenagers. History of physical or sexual abuse, problems with alcohol and drugs again. Physical or medical issues, for example, becoming pregnant or having a sexually transmitted infection. Being a victim of bullying, that's a big thing nowadays in school. Being uncertain of sexual orientation. Reading or hearing an account of suicide or knowing a peer who may have died from suicide. Diagnosis and treatment. The doctor may do a physical exam, tests, or in-depth questioning about one's mental and physical health to help determine what may be causing their suicidal thinking and to determine the best treatment. Assessment may include mental health conditions, physical health conditions, alcohol and drug misuse, medications. Children and teenagers feeling suicidal usually need to be seen by psychiatrists or a psychologist, and adults as well can also see them. Experiencing and diagnosing and treating children and mental health problems. In addition to patient discussion, the doctor will want to get an accurate picture of what's going on and a variety of sources, such as the parents or guardians, or the close to the teen, school reports, previous medical or psychiatric evaluations. Treatment of suicidal thoughts and behavior depends on your specific situation, including the level of suicidal risk and what underlying problems may be causing the suicidal thoughts or behavior. Prevention. Get treatment if you need it. Establish a support network. Remember, suicidal feelings are temporary. Suicide is preventable. And everyone has a role to play to save lives and create healthy and strong individuals, families, and communities. Suicide prevention requires a comprehensive public health approach. Complications, suicidal thoughts, and attempted suicide take an emotional toll. For instance, you may be so consumed by suicidal thoughts that you can't function in your daily life. And while many attempted suicides are impulsive acts during a moment of crisis, they can leave you with permanent, serious, or severe injuries, such as organ failure or brain damage. For those left behind after suicide, people known as survivors of suicide, grief, anger, depression, and guilt are common. So what are some common myths about suicide? There are several common myths about associated with suicide. A person must have a mental illness or to commit suicide. That's a myth. Only trained professionals can help individuals experiencing suicidal thoughts. People who talk about suicide are just seeking attention. That's a myth. Suicide occurs without warning. That's also a myth. People who take their own lives are selfish. That's a myth. They're going through some challenges. Suicide can't be prevented. These myths are simply not true. It is important that people remember that each of us has, again, a responsibility to take care of the people that are around us. Help is available. If you or someone you know is in an immediate danger, call 911 in Canada. Help is available 24/7 for suicide prevention. There's Talk Suicide Canada. For Quebec residents, there's 1-866-APPELLE or 277-3553. There's Kids Help, and there's Hope for Wellness Help as well. Suicide in Jamaica, West Indies. Let's talk about that. I missed a slide, I'm sorry, my apologies. In Canada, there's actually reported that there's 12 suicides on a daily basis in Canada. So please be mindful of that. In Jamaica has seen a notable increase in the number of suicides, with the majority of these tragic deaths being older men. This rise in suicide must raise serious concerns about health officials, families, and communities. According to the data from Jamaica Constabulary Force, there are 27 reported suicides between November alone last year and January, a significant increase compared to previous years. Of these, 23 were men, with the majority being over the age of 40. Some things that they're relating this to is going through the pandemic, social challenges, financial challenges as well. For Helpline in Jamaica, there's a Ministry of Health and Wellness at 1016 Grenada Way in Kingston 5. And the number there is 876-633-8103. Or you can call 1-888-NEW LIFE. US statistics. Suicide rates in the US have increased approximately 36% between 2000 and 2021. Suicide was responsible for 48,183 deaths alone in 2021. Suicide affects people of all ages. In 2021, suicide here was among the top 9 leading causes of death for ages 10 to 64. Available helpline here in the US, they can call or text 988. They can chat on a 988lifeline.org, and the CDC suicide prevention resources are always available. So does suicide vary by race and ethnicity? Some groups have higher suicide rates than others. Suicide rates vary by race and ethnicity, age, and other factors, such as where someone lives. By race ethnicity, the groups with the highest rates are non-Hispanic American Indian, Alaska Native people, followed by non-Hispanic white people. Other Americans with higher than average rates of suicide are veterans, people who live in rural areas, and workers in certain industries and occupations like mining and construction. Young people who identify as lesbian, gay, or bisexual have higher prevalence of suicidal thoughts and behavior compared to their peers who identify as heterosexuals. A reminder, if you have a loved one who has attempted suicide, or if you think your loved one may be in danger of doing so, get emergency help. Don't leave the person alone. If you have a loved one who think or considering it again, I implore you, don't leave them alone and get them help. Get the qualified doctor or mental health provider to make an appointment and get them the help that they need. Supporting a loved one who is chronically suicidal can be stressful and exhausting. You may be afraid and feel guilty and helpless. Take advantage of resources about suicide prevention so that you have information and tools to take action when needed. Also, take care of yourself by getting support from family, friends, organizations, and professionals. I want to give special acknowledgement to jcf.gov.jm, cdc.gov, Cedars-Sinai, Mayo Clinic, and Canada.ca for the information that I provided you today. And if you're online and you're watching the service, I want you to think on the things that are true, the things that are honest, things that are just, things that are pure, things that are lovely, things that are of good report. And if there's be any virtue and if there be any praise, think on these things. Know that God is able to do exceedingly abundantly above all you can ever ask, think, or imagine. So stay tuned on this service for the word of God, a word that will encourage your heart to know that you're not alone. God bless you and enjoy the rest of the service.